I don't want to use Accutane. That's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice solely treating acne. That's all we do. We focus only and specialize only in the treatment of acne. So we have different insights and experiences that we like to share with acne sufferers who are navigating the path toward clear skin. And we hope you find this information useful, but remember, this is not medical advice. This is only for educational value. So a common theme, and I've seen it again this week in my practice, patients come to see us and the first thing that they say is, I don't want to use Accutane. Now, that is something that needs to be discussed because the reasons that people decide that they don't want to use Accutane are varied. There are a lot of different reasons why people might feel that way. And each one deserves discussion because not only is it important that the patient understand the ramifications of making that statement and understand why or why not that's an accurate statement for the particular reasons that they have in mind. And it's also important for the doctor to understand, why is my patient against Accutane? Is it for a reason that is understandable, that makes a lot of sense for that particular patient's circumstance? Or is it a reason that might be born out of information that might not be completely accurate? So that's an important theme that is encountered routinely in our practice. Patients often have reasons that they may or may not want to use Accutane. So this week, there were various scenarios similar to that, and some of them were focused on the fact that certain side effects were just not acceptable and they didn't want to use Accutane for those reasons. And in some cases, they have tried a lot of other treatments, they've been to other dermatologists, and they were unsuccessful in getting better. So Accutane looked like it was something that was the only thing left, but they were adamant about not wanting to try Accutane. And on top of that, their acne bothered them a lot. So it wasn't something that wasn't an issue for them. They were very concerned about their acne, and it really had an emotional toll for them. But they were just dead set on not considering Accutane. So what do we do in those cases? So like I mentioned, the first thing is to discover what is the rationale. Why is a patient very adamantly opposed to taking Accutane? So we like to find out exactly what is on the patient's mind that's keeping him or her from using Accutane. Now, in some cases, it has to do with some of the side effects. And for example, dryness. So the patients have experience with friends or siblings who took Accutane and became very, very dry and uncomfortable. And the patient just doesn't want to have that happen to them. The patients want to avoid that at all costs, and they want to use something else. And so what's the reality there? So it could be dryness, it could be something else, it could be another potential side effect. Maybe they feel that Accutane is just too aggressive overall, or it could be that they have concerns about the potential side effects on their body, their liver function, or some other reason that they are concerned about exposing themselves to Accutane. So one of the things that we like to discuss is the fact that, as I talk about all the time, treating acne is not one size fits all. You can't use the same medicine and the same regimen for every single patient in the same way. You just can't do that because every patient is different. Now, some patients tolerate certain medicines, other patients don't tolerate those same medicines. And so when it comes to Accutane, it's not any different. So when we have a patient who is very concerned about certain things about Accutane, or in general, they just don't want to use Accutane, we start the discussion. We start a dialogue, and we never try to convince a patient to use any particular medicine. Our goal is not to try to convince a patient that one medicine must be used over another medicine. What we do is we discuss the opportunity of all of the different options. And we go into them in detail, and we talk about using topical medicines and using different pills, and we talk about the different benefits and risks and pros and cons and potential side effects of all of those options. Now, there are times when a patient isn't getting better on other options, and really Accutane sometimes is the only last resort to consider. And in those situations, we still don't try to convince a patient to use Accutane, but we like to be very honest and truthful that sometimes Accutane might be the only thing left to help them. And we explore their reservations, because sometimes there are ways of getting around some of the concerns that they have. And that's important because, as I said, treating acne is not one size fits all, and the treatments are not always the same for each patient. So we can use the same medicine, but we can use it in a different way in some patients to try and avoid certain concerns that they may have or certain side effects that they may develop. So when it comes to Accutane, sometimes the patient's just worried that it's too harsh, or that it might affect them if they're doing sporting activities, or it might affect them because it'll make them uncomfortable or make their lips too dry and uncomfortable. So we talk about those things. And it's true that Accutane does have certain side effects. Just like any medicine, there are always going to be potential side effects, and there are some that are more common than others. Having dryness and lip dryness is one of those that is very common. And there's some degree of that probably in almost every patient who takes Accutane. So what do we do about that? So we talk about ways of using Accutane that might lessen that effect. For example, Accutane can be taken in various regimens. There are a lot of reports of using Accutane in high dose, low dose, intermediate dose, different types of courses of taking Accutane, different durations, different cumulative doses. So there are lots of different ideas about how to use Accutane, and different doctors and different patients decide on different regimens. So sometimes we can use Accutane in ways that can lessen some of these side effects that really concern patients and prevent them from wanting to consider it. So if somebody's really concerned about the excessive dryness that might occur, well, first of all, most patients tolerate it very well. They use moisturizers and they get through it. We also combine the use of omega-3 supplements, and that's been shown to help with the dryness. And in my patients, it has helped quite a bit. But other ways that we can get around that are sometimes we use the regimen in a little different way. So for example, instead of taking Accutane every day of the week, we might take it only Monday through Friday and take the weekend off. And sometimes that alone is enough to lessen the intensity of some of the side effects, like dryness of the lips, for example. Sometimes we use it 1 week on, 1 week off when somebody's having a particular circumstance that we need to try to address. So my point is that there are different ways of using Accutane, and we can use it in a low dose format throughout the whole treatment. And sometimes that's a necessary way to go. And sometimes that's more reassuring and comforting for a patient who has various concerns. So my point is that patients might feel that right from the get-go that Accutane is not right for them, and they just don't want to take Accutane. But when we really get into the understanding of what's going on, what are they thinking, what's in their mind, and we talk to them, and we take time. It takes time. You can't just come in and out in 2 minutes of an office visit and expect that you're going to be able to relate to your patient's concern and address it. It takes time. So we spend lots of time with our patients, and we address these concerns, and we give them these options about taking Accutane in different ways. And sometimes that's all it takes for a patient to feel more reassured and more comfortable. And in those circumstances, they might feel that they do want to use Accutane treatment. So it's important to identify with these concerns because some of them are valid, and some patients do have reasons, maybe because of their medical history or because of some other reason, potentially a type of job that they do or some other events coming up in their life or some types of hobbies that they do that maybe taking Accutane with certain side effects might become a problem. So by having a discourse with each patient with a certain concern, sometimes we can come up with a way of using either Accutane or another medicine that might also fall into this type of concern. And we might be able to find a regimen that might be acceptable, that might address some of these concerns and allow a given patient to access Accutane or another medicine that they normally would have considered off limits for themselves. So that's important to consider. And oftentimes when a patient completely rules out a given treatment right off the bat without even considering the fact that there might be some alternative ways of using it, sometimes can be addressed and result in a very productive treatment.